Biomechanics gait. Normal gait is defined as form of bipedal locomotion, or as a method of locomotion involving the use of the two legs, alternately, to provide both support and propulsion, at least one foot being in contact with the ground at all times. It is a series of rhythmic alternating motion of arms, legs, and trunk that create forward motion. In order to walk, one each leg able to support body weight without collapse. 2. Maintain static and dynamic balance during single leg stance for maintenance of upright posture. 3. Sufficient power for limb motion and to advance the trunk. 4. The swing leg able to advance to a position where it can take over the supporting role for proper gait. 5. Proper proprioceptive system. 6. Normal vision. 7. Training and experiences. Phases of gait cycles. The gait cycle begins from heel contact of one foot to the next heel contact of the same foot. During one gait cycle, each lower limb has two phases: single stance phase and single swing phase. Stance phase. From heel contact till toes off of the same foot, 60% of gait cycle, called weight bearing or supporting phase. It is subdivided into 3 intervals. 1. Initial double stance, 10% of cycle of stance. 2. Single leg support, 40% of cycle of stance. 3. Terminal double stance, 10% of cycle of stance. 5. Subphases of stance phase. Initial contact or heel strike, 2% of gait cycle. Loading response or foot flat, 2 to 10% GC. Mid-stance body weight over one leg, 10 to 30% GC. Terminal stance or heel off, 30 to 50% GC. Pre-swing or toe off, 50 to 60% GC. It is subdivided into 3 subphases. Swing phase. From toe off to just prior to heel strike of the same foot, called non-weight bearing period, 40% of GC. It is subdivided into 3 subphases. 1. Initial swing or acceleration from just toe off till maximum knee flexion or the swinging limb is direct under the body, 60 to 73% GC. 2. Mid-swing from max knee flex till tibia vertical on ground, 73 to 87% GC. 3. Terminal swing or deceleration from vertical tibia position to just before heel strike, 87 to 100% GC. Increase of gait velocity will decrease gait cycle time, and swing time will increase in relation to stance and double leg support, and with running no double leg support, and there is a float period. Gait analysis consists of kinematic and kinetic analysis. The kinematic analysis includes 1. Distance and time variables. 2. Measurement of joint angles of lower limb and upper limbs. 3. Determinants of gait. 1. Distance and time variables. 1. Step length, 70.5 cm, 64 cm female, 73 cm male. 2. Stride length. 3. The width of the base of support, 1 to 5 inches. 4. Degree of toe out, about 7 degree. Time variables: step time, stride time, stance time 0.6 seconds. Swing time 0.4 seconds. Single limb time. Double limb time. Cadence, number of steps, unit time. Average 113 per minute. Walking velocity, distance per minute. Average 82 meters per minute. 2. Measurement of joint angles. Lower limb, hip, knee and ankle joints angles in sagittal, frontal and transverse planes. Upper limb, shoulder, elbow and wrist joints angles in sagittal, frontal and transverse planes. Head, trunk, and pelvic displacement during gait cycle in vertical, lateral and progression. 3. Determinants of gait. 6. Determinants present, adjustments made by the body that help to keep the motion of cog to a minimum. 1. First determinant, pelvic rotation in the transverse plane. 2. Second determinant, lateral pelvic tilting in the frontal plane. 3/3 knee flexion in stance phase. 4th and 5th determinants, knee, ankle and foot interaction. 6th 1. Physiologic valgus of the knee. The width between the hips 20 to 25 centimeters and the normal step width 8 centimeters. So because the base of support is narrow, little lateral motion of the body is necessary to shift the cog from one lower limb to another over the base of support. 5 to 10 degrees is the valgus angle of the knee. Functions. 1. The determinants minimize the up and down, and side-to-side motion of cog to reach only 2 inches. 2. They produce a smooth sinusoidal curve of the cog. 3. Decrease the energy expenditure during normal walking. Kinetic analysis. It is the analysis of the forces acting on the body during the gait. It includes internal and external forces. External forces, like inertia, gravity, and ground reaction force. Internal forces, by the muscles which assisted by tendon, ligaments, joint capsules and bony component. External forces. The force of gravity acts directly downward through cog of the body at which the body weight is represented by a line. The GRF represents the force of the ground on the foot and it is equal in magnitude and opposite in direction to the force of gravity. From lateral view, it passes via line of gravity. It is an imaginary vertical line which passes perpendicularly in the body and connects between the cog of the segment above by the cog of the segment below. From lateral view, it passes via vertex. Mastoid process. Atlanto-occipital joint. Behind the cervical spine. At the junction of cervico-dorsal vertebrae. Anterior to the body of the dorsal spine. At the junction of dorso-lumbar vertebrae. Posterior to the body of the lumbar vertebrae. Anterior to second sacral vertebra. Just behind or via the axis of the hip joint. Anterior to the axis of the knee joint. Anterior to the ankle joint at the level of tarsal bones at about 5 cm. Anterior trunk bending, posterior trunk bending. From front view or back view. The vertical log passes through the body's cog which bisects the body into equal halves with the body as equally distributed between the 2 feet. The location of the log relative to the axis of motion of body segment will determine the motion direction. GRF vector are forces that act on the body as a result of interaction with the ground and composed of 3 forces. 1 vertical and 2 horizontal forces, medial-lateral antero-posterior. The point of application of GRFV is the body center of pressure cup, which located in foot in unilateral stance and between the feet in bilateral standing posture. The cup move from sterolateral edge of the heel at heel strike to second and third toes at terminal stance in linear fashion. The pathway of GRFV during stance phase in sagittal plane. Initial contact, anterior to hip and knee and post. To ankle. Loading response, anterior to hip and post. To knee and ankle. Midstance, post. To hip and anterior to knee and ankle. Terminal stance, post. To hip and anterior to knee and ankle. Pre-swing, post. To hip and knee and anterior to ankle joint. Internal forces. They are developed during gait by muscles and the structure which assist the MS by resisting, transmitting and absorbing forces like ligaments, tendons, capsules and bones. The moment created by GRFV is counteracted by muscles activities and other soft tissues. As a principle to identify muscle action and type of contraction put in your consideration. If the GRFV passed anterior to joint, the posterior muscles will produce counterforce. The relation between these forces will determine the desired motion.